going to show you 3 tests that you can do at home to try to find out what is causing your low back pain. So we talk about this a lot, but the most important thing fixing any problem in the body is finding out what the cause is. And there's lots of different things that can cause low back pain. 3 main things that can cause low back pain: stenosis, some kind of disc problem, or an SI joint problem. I'm going to show you a couple tests that you can do at home to try to help figure out what that is. First one is really simple. It's just a forward bend test. So all you're going to do is keep your legs straight, and you're going to bend forward, and then just see what happens to your symptoms. And if you bend forward and you have back pain, and that back pain gets worse the more you bend forward, or if that back pain goes down the back of your leg, pretty good chance that you have some kind of disc problem that's going on in your spine. So some kind of bulging, or perhaps a herniation, or just a disc irritation. If you bend forward, what happens is you put pressure on the front of the disc, and that will push the disc material towards the back, and it will put pressure on nervous structures that are back there. So spinal nerve roots, or even the spinal cord, puts pressure on that, causes an increase in pain. You can also have a facet joint irritation as you bend forward. If your facet joints are stuck, those facet joints are just joints on either side of the spine. So if you have pain that gets worse when you bend forward, pretty good chance you have some kind of disc problem going on. Next test I'm going to show you is called a quadrant test. So you're going to put your hands on your hips. You're going to kind of extend back. You're going to turn. So if you have pain, let's say at this side, you're having pain on the right side in this scenario. If you're going to extend back, rotate to that right side, okay, and then side bend. So you're trying to getting your weight kind of rotated back and put some pressure on that part of your spine that's bothering you. If this makes the pain worse, what's happening is you're closing down on the vertebral foramen, which is the holes that the nerves come out of in your spine, and you're putting a little bit more pressure on that. If that makes the pain in your back worse, then it could be an indication of some kind of stenosis issue. So as the narrowing happens as you get older, you're actually making the hole a little bit smaller, so that can be an indication of stenosis. Could be, again, an indication there's some kind of facet joint issue going on too. But if it just stays kind of right in your back, then that's probably what's going on. If it goes down your leg, then as more pressure gets put on there, as that vertebral foramen gets smaller, then what can happen is it will send that pain down your leg, and again, that's an indication there might be some kind of stenosis issue going on. The final test that we'll do is for nerve tension. So from here, what you're going to do is just kind of put your hands behind your back. If you can't tolerate your hands behind your back because it's kind of a shoulder problem, just put them down by your side. But hands by your back, you're going to tuck your chin, lean forward, and then you're going to extend your leg with your toe up towards you. So you do this until you feel a pull in the back of the leg. If you have a lot of nerve tension, meaning the nerves aren't moving smoothly in the path that they travel, you might not be able to go very far. That's okay. Just kind of bend forward, chin down, toe up, and then go until you feel a pull in the back of the leg. Once you feel that pull, if you lift your head up and those symptoms get better, that's an indication that you have some kind of nerve tension issue. So nerve tension doesn't mean nerve damage. It just means that the nerves aren't moving smoothly in the path that they travel. So if you have numbness, tingling, burning, or even just pain going down the back of your leg, and when you lift that head up during that test, if that makes that better, it's an indication that you've confirmed that you have some kind of nerve irritation issue, usually from the sciatic nerve, as that comes out of the low back and goes down the back of the